All right, well, thank you all and welcome to our Aunt Bertha training. My name is Sonia Bingaman and I am with the State Council on Developmental Disabilities. I'm the manager of the Sacramento Regional Office, so we have offices around the state. So you may know who your local manager is and be involved with their office and the activities that they're doing. This is a statewide training, so we welcome people from around the state. The information that Anthony is going to share is relevant for any of your communities, so we're glad that you could join us. So the State Council, at least the Sacramento area office, represents our local 10 counties. You can look on our website, www.scdd.ca.gov. I'll put that in the chat box. You can see where your local office is. The State Council is established by state and federal law as an independent state agency to ensure that people with developmental disabilities and their families receive the services and supports they need. So we don't replace any of the services that you're receiving, for example, through the regional center system, but we add to them. We do a lot of trainings, we do advocacy, we do legislative advocacy, sharing information throughout our communities on a variety of topics that affect people's lives. So feel free to reach out to your local office and make sure that you're on their email list, as well as if you want to be on the statewide email list for the State Council. During COVID-19, we've been doing a lot of work, especially coordinating statewide training since we're now using the Zoom platform. And so we can do a training like this from one region and have it available to everyone statewide. So glad that you could all join us. So today we're doing a follow-up training from one we did about a month ago with Anthony Pico from Aunt Bertha on this resource, and the people who attended the conference, attended the training, were so excited about what they learned. They said, please, please, please do this again so that other folks can learn about this online resource. So here we are. I'm going to turn it over to Anthony. I first thank you for filling out the registration questions. Some of those are questions that we need to report to our federal funders about who you are and a little bit about you. And toward the end, we'll ask you if you feel like you learned something and benefited from the training. So at that point, we'll do a poll toward the end of the training. So again, thank you for joining us. Feel free to use the chat box to put any questions, or if you have a question, Andrew Pentecost from California Health and Wellness is also helping us out with this training, so we thank them for their support. Andrew and I will be keeping an eye on the chat, so if you're too shy to speak up, just post your question there, and or you just take yourself off of mute and you can go ahead and ask a question at any point. Anthony's happy to answer your question as we go along. So again, thank you for joining us, and Anthony, thanks for offering this training a second time.
Oh, of course. It was my pleasure. Thank you. So before we dive in, I do want to encourage everyone to use the chat while we're going along to ask questions. I'd love if people would actually use the chat as I'm doing my little intro and just share your name, organization, and where you're from. Morena, the same information that we did in the first workshop is going to be the information that we go over here. So no worries about what you missed. You didn't miss anything. If anything, now you get my pretty face when I didn't have it last time. So without further ado, we're going to get started. So today what we're going to do is go over the background of Aunt Bertha, the problem that we started addressing back a decade ago, and how we've been working toward a more integrated national social care network. I'll go through a full demonstration and how you can search, how you can use all the tools that are available to you, and then any next steps at the end, in addition to the little poll that we'll do in this actual presentation. I will send out a link for follow-up, just so then I know what went well and what could be improved. And we always are looking for feedback, and I am extremely excited that we have people from across the state. So Aunt Bertha started with the idea that we will connect all people in need with programs that serve them with dignity and ease. And we say dignity and ease as in a dignity of response, a dignity in access, so then you don't have to go and feel embarrassed asking questions that you may not know the answers. Like, I'm not sure how to ask for help, but I know I need help. So giving a dignity in that is what we're attempting to do, and ease of access, because what we've seen is, uh, I always share that I've been on every side of social services and child welfare specifically. I grew up in the foster care system in San Francisco, and I knew how hard it was to find services as a teenager. And then I worked for the state assembly. I was in the state capitol, and then I was also a caseworker. And so navigating the government side of everything was difficult. And then when I was doing direct services in the nonprofit world, it was also, how do you find all the information? How do you get to a place where you have all of your go-to organizations? Usually it's Post-it notes and a binder or a notepad or a Word doc. And so what we're trying to do is change the way the system is now, which is seeker. We call people seekers, is anyone who is looking for services at any point in their life. So whether it be you're looking for yourself, helping someone close to you, like a family or friend, or you're in the helping profession and navigating people to services. Everyone at some point needs help. And so we call everyone that is looking for help seekers. Then you have programs that are serving the needs of that seeker. And right now, generally, it's near impossible to find all of the programs that are in your neck of the woods. So what Aunt Bertha did and continues to do is create an easy way for people to access services. The way that we have it is, if you go to any of our websites, you would type in your zip code. It would then launch into a page that shows you all of the programs that serve that zip code. And that's federal, or like nationwide, statewide, countywide, and locally based programs that serve that specific zip code. And then you're able to browse any of the services and find what matches for you. And we have multiple ways that people can connect with ease to these programs. So you may be wondering, who is Aunt Bertha? What is Aunt Bertha? You just heard that this was a cool resource. So Aunt Bertha is a free online directory. At its core, we are always going to be free, and it's free for anyone who is looking for services, anyone who provides services, and we provide lots of free tools for nonprofits. And so you may be wondering, well, how does Aunt Bertha make their money? How do they pay for everything? Because we do not sell people's data. We do not monetize any of that. So what we do is we sell a version of Aunt Bertha to different companies like Los Rios Community College District, AARP, American Red Cross. All of those companies have a version of Aunt Bertha that they use with their communities. And so on the back end, we do integrations for their caseworkers to be able to better serve their clients. And that's kind of the basis of how we do our work. And so we use what we make through that and reinvest it in the community. Through people like me who just go around like the Oprah of nonprofits, and you get free stuff and you get free stuff and everyone gets free stuff. And so I'm looking at the chat real quick. There is no Q&A tab. You can just put it in chat. If you are worried about asking it for everyone, you can send it specifically to me or Andrew. I'm going to be going through some of the differentiators and how we get our data in a moment. So I'll jump into that momentarily. And just a quick background of what is Aunt Bertha. So there is no Aunt Bertha. It was our founder, who had been his mother's caretaker, who had a rare brain disease that gave her a form of amnesia, that she lost the memory of giving birth to him, of raising him, and ended up having a capacity similar to an adolescent or child. And so he became her caretaker and couldn't find services. And this was during the first .com boom. And he left tech to go and work for the state of Texas, where he lives, to try to help people navigate into services, and found that government can only go so far, and that nonprofits and community organizations are really what get everything going in the community. And so he wanted to originally name us Aunt Sue because Aunt Sue picks up where Uncle Sam leaves off, but that was taken, and so we went with Aunt Bertha. Uh, Across the country, you can see here the growth over time for Aunt Bertha. When we started in 2011, you can see that New York and Texas were our main populations, because Texas is where we started, and New York City actually uses us as their kiosk system. So if you ever go to New York and you see the NYC link, if you go on their little computer that they have on those, and you're searching for services, they actually go into our service database to find those for the people in New York. Over time, we've grown to be in every single zip code in the United States, and that includes Puerto Rico and American Samoa, because the American Red Cross does use us as their emergency response resource. So when people are experiencing uh, crisis and disaster, they will send out their version of Aunt Bertha for people to access and search for services as they relocate after a disaster occurs. As of right now, we're close to 400,000 program locations across the country that are listed, and every single county has at minimum 875. I think it's probably edging closer to 1,000 at this point, resources that any zip code that you type in will have at minimum that many from national, state, county, and local programs. Now, we actually have invested heavily into having a individual human like stopgap and verification. So we don't scrape data. We don't have an automated service that brings data into our system, and we don't buy data from people. So the way our system works is that over a third of our company are individuals in Austin that research new programs and verify programs as they become known to us, either through suggestion, and I'll show you how to suggest programs, or through their research. And that's because it's our commitment to quality, and along with having that initial review by a person to be put into our system, we have every 6 months another check on those programs to make sure that they still exist. While nothing is perfect, I think that we do a pretty darn good job about it. And so, of course, if you are encountering any issues, I will show you how to suggest edits if your program hasn't been updated because you changed your location, or hours changed due to COVID. And yeah, so who uses Aunt Bertha? What I've talked about is seekers.
Anthony,
Yes.
can we pause real quick for a couple questions?
Yes.
So it looks like Shanice was asking I think it's a couple slides back, how is this different than 1 degree?
Yeah. So I was reading those, and I was going to get into that in a second. But 1 Degree is a nonprofit that has a similar social services database. They're based in San Francisco, and I would say the difference is that Aunt Bertha has a heavy nationwide network as well, and I don't know the extent that 1 Degree has. And for our coordination with 211s, as you probably know, every 211 is different. Not all of them are run by the United Way. So in some places we have a data sharing agreement where anytime we get updates, we provide that to the 211 so they can do that good person-to-person contact. And then if they get any updates, then we have it updated for our purposes of allowing people to have that best information. Sometimes we are actually the data service for a 211. So when someone calls 211, they're using Aunt Bertha to find and refer people. And generally, we're always trying to be good partners to anyone who wants to collaborate. So if you have any other thoughts or ideas of how we can coordinate and collaborate, we would love to. When I say a version of Aunt Bertha, I'll show you what that means in a moment when I go through the live demo. We currently do not share with the Contra Costa 211, but we would love to. As far as I know, we do not have Bay Area 211 agreements yet, but the Redwood Community Health Coalition up in Marin and that area, they have 211 at their roundtable, and we are part of their services that they use. So really good questions. I appreciate it, because sometimes I'll go through an entire presentation and have zero interaction from people, and then I worry that everyone had disconnected.
Okay, so Anthony, there are several other questions. I'll just compile them and wait for you to break, and we can go through them at that time.
Yep. So who uses Aunt Bertha? What we say is seekers, helpers, and community-based organizations. So a seeker, of course, is that person who is looking for services. Helpers are those who are helping navigate people to services, and community-based organizations, some of which are on the call right now, but many of us have interacted with them over our time. All of those people together have what we call the social care network, so that everyone can communicate with each other, and it's not just a one-way. I work at a service organization and I'm making a referral and that's it. There's different ways that people can communicate together within our network. As you can see here, it's a snapshot of some of our California customers. So if you were wondering who do we work with here, there's multiple organizations that we have different levels of interactions with. And if you're interested in learning anything about that business side, I don't handle that, but if you go to company.auntbertha.com, you can actually see what is it that we do with customers and transparency and pricing and all of that. Just so then you can see here, we also try to do our best to be responsive to people's needs as it comes up. So Anthem is one of our customers, and if you go to their website, whatever zip code you type in California, it will pop up with food sites in response to COVID-19 that come for that specific county. I just wanted to show you this briefly, that clearly we all know that California has been in a housing crisis for, very, very long time. And that was the main need that people had pre-COVID-19. But after COVID-19 hit, we saw a significant transition to everyone having food insecurities. And so after the state of emergency was declared, we actually switched our entire company into responding to COVID-19, gathering more programs that are specifically in response to that, and loading it up. So within 2 weeks of COVID, we ended up having, within 2 weeks, we had like probably 1,500 to 2,000 programs that were in relation to COVID-19 across the country. And I think California had the second most programs that we were able to input immediately. So California does a great job of providing services, and we're really happy to be able to work with everyone here. So we do not have an undocumented relief funds. If there are direct services that provide that, they can be listed. Local contractors who use Aunt Bertha, trying to get Bay usage and investment. So Shanice, we can have a really great conversation on a one-on-one after this. I'd love to dive deep into these conversations. So please keep asking them, keep writing them down. My email will be at the end. But we've got different people that use it in different ways. And so rather than go into all of that, I'll continue on in the demonstration. So when I said we have versions of Aunt Bertha, this is Aunt Bertha, if it remembers to type. So this is the free version of Aunt Bertha. It will always be free. You don't even have to log in to be able to search for services. We also had findhelp.org, which was launched, and that was specifically in response to COVID-19. So anywhere that you type, let's go with Sacramento. If you choose any of the programs, the first programs that are listed are boosted up if they are COVID-19 specific tags. So if I'm going to look for food, emergency food, if there are any emergency food services that are in Sacramento that were for COVID-19, you can see here there was that COVID-19 response tag. Additionally, if you go to AARP or Anthem, you see, this is what we mean by a version of Aunt Bertha, so that people know and understand what AARP is, or what Anthem Blue Cross is, or whatever our customer versions are. So then they're able to access it through there. So what I'm going to do right now, actually, let's see. I think I can do Fresno. I don't know if anyone's here from the Central Valley. So as you can see here in Fresno, we have nearly 2,000 programs listed that serve the people in Fresno. And what I'm going to do is I'm going to go to care, and let's see, really for caregivers. So as you can see here, there are hospice services and different kinds of adult daycare centers for Fresno specifically. Inside of each of these, what we call program cards, are the most basic information, a snippet of what they provide, their contact information, and here at the bottom of the program card, you can save into your favorite folders. If you're working with someone and they need to either self-navigate, or you want to just send them the information, you can actually send this through our system. We don't share your email with anyone. It's just so then we know you're a person. And so this would be an email that sends this program information to the person that you're emailing it to. You can also send it via text. So for anyone that lives off their phone, I know that a lot of people in the more transient or people experiencing homelessness communities are tied to their phone. That's their lifeline. So if you need to share that with anyone, that comes from our systems as well. And then you can also share it on Facebook. We are not Yelp, so we don't have a grading system, but I'll log in a moment, just so then you can see what it looks like for you to be able to make your own internal notes. And if you're part of an organization that claims their program, you can actually have us turn on your group share. So you can save notes about, like, I talk to this person regularly, they're the ones who handle my region, or anything like that. And you can save it for yourself, or you can share it with your different work groups inside of your organization if you have those turned on. You'll see here as well the refer button. So there are different ways that we have programs listed. You can see here is next steps. Here's the refer. I'll show you what what each of these means and what they look like. But the refer button is what we talk about when we say easy, quick ways of connecting. So I can refer someone else, or I can refer myself. Usually if you're helping people on a regular basis, I usually use my cat as the example. You see his name popped up, and it automatically fills out all of his information for an outbound referral. I would click what his best way of being contacted is, and that I do have his verbal consent to make this happen. Once I send that email out, the community organization on the other side will receive an email that looks like this, where it gives my first name, and last initial. It will give my cat's name and contact information, letting them know that Malik was looking for services, and then a quick, easy way of closing the loop for organizations. So you don't even have to log into Aunt Bertha if you get these emails. You can just click and it will close out that referral so that everyone knows whether or not the individual being referred was able to receive help. Now, there's also this, I will show you what the screener is in a moment, but we also are high trust certified for cybersecurity. It's the highest standard that you can have. And then we are also HIPAA compliant. So if there's anything beyond a name and number, it gets locked into the system so that you have to log in so you can view that information for the person who is being referred to you. So I'm not going to send a real referral to that organization because my cat does not actually need to be at an adult day center. But you can see here, if you click on more information, organizations have the ability, once they claim, to own all of this information. And the way that you can do that is just claiming at the bottom. But what you have is the ability to change your eligibility requirements, change whether or not it's available, on hold, wait list, out of funding, closed, temporarily closed. I'll show you how you can edit all of this in a moment, but the additional description, if you have any other information that you wanted to include, additional languages that you might cover. And then if you're looking at services, you can see the last time either we or the nonprofit that had claimed had updated their information here. And so what I want to do next is I'm going to show you back at auntbertha.com. We have Google Translate as an integration to our site. So if you are working with any communities or individuals who are more comfortable reading another language, this does get translated into whatever languages, over 100 that are currently available. I know that in parts of the Sacramento community, Hmong is a very used language, and so this translates into their language. You can then navigate based on that in that person's language with them on their behalf, or printing out this information for them, all in their own language. If you are searching and become aware that you need to change the language, you can always do it below the search box. And then if we are going to I'll show you also the personal search filters. So if you are looking and you need to narrow it down to seniors only, or certain aspects of a person's needs or qualifications, this is a dynamic drop-down menu. So as the programs change, if, say, none of them serve people with substance abuse, then these would all disappear. Additionally, you can do program filters for time of day when they are open and the languages that they provide services in. And this is either explicitly stated on their website when we're adding them, or self-selected and added by the organization themselves. This is what a claimed program looks like, because it has a little check mark. You can hover over it, letting you know that someone at their organization is claimed. And if you are ever wondering if there is information that is not fully accurate, you can click suggest. You don't even have to log in. You can just type in your email here and send that information over to our data team. That way that they will review and make sure that that is accurate before updating. So you don't have to worry about folks going in and randomly updating your program. We make sure that that is updated as well. You can also do an income eligibility. So if you have someone that you're helping that has a certain level of income, you can narrow down programs for that. Again, all of our programs are free or reduced cost direct services. So these are all programs that have a sliding scale or accept insurance or are free, whatever it may be. And that's how they get listed, and we have those requirements. And then if you are wondering, well, Anthony has talked so much about claiming, what does that mean? How does that work? I will get to that in a moment. I'm going to check the chat to see what we can talk about. So I think, do you have agreement with orgs in the database that will respond to referrals? So we do not require like service level agreements or business agreements with these nonprofits, because we don't want to add another requirement and another system to their way of operating. So this is for them to be able to use in whatever way is appropriate for them. And once they claim, they can choose whether or not to receive referrals in a one-click manner, use an eligibility screener for free, or have it launch out into their own site. And how do we keep services with possible budget cuts on the rise? So, I mean, that's more of a holistic conversation to have, because we don't provide direct funding to organizations, but with using this site, many of our customers do have their own foundations and philanthropies that can backfill organizations that have been interacting with their clients a lot. So using this is a great way to provide that data. And you also get free data when you claim your program for free. And I'll show you all of that in a moment. 211 San Diego's Community Information Exchange. I believe my colleagues are aware of that. I haven't used it specifically. So back to our regularly scheduled program. In order to claim a program, you would click on the bottom, claim, or go to auntbertha.com/claims and search for your program. I usually search for Peace for Kids because they're an organization that I work with in LA. And you can see here, they pop up. And I can start going through the claim process by clicking claim, but I'm not going to click that because it would, claim on accident possibly. You can see here that the organization's program card shows that they are claimed here. And say you work for an organization that someone claimed your program in the past, maybe your marketing director or a staff member that no longer is here, you can claim it again and have access to add or remove folks as you see fit to your organization. If your program is not listed, you would click down here for suggest a program, and it brings you to this page in which you can search. I know that Anthony Pico Incorporated is currently not a provider of anything. So you can see here, looks like we don't have that program. Then you can just type in, all we need is the name, state that they provide services and website, as well as your email address. So we can follow up if need be. And also, if you work at that organization and you're listing your own information, you can click I work here, so that you'll most likely get an email from me following up saying, hey, do you need help claiming? And that's the way that you submit a program. Usually 2 to 3 days is our turnaround on addressing that. So once you've claimed, you get this nifty little toolbar of My Program Tools. Let's see, chat. What do you mean by claiming a program agency organization? To claim a program with additional documentation needed to be provided outside of the form online. So I'll show you, let's see. I'm gonna actually look for a program to claim that is in our demos. So anyway, so when you claim your program, you would go type in the information, you would click claim. It would bring you to the next page, which would be to choose an account. If you have an account already, you would log in. It needs to be verified based on your organization's email. So if I work at Aunt Bertha and my email is at Aunt Bertha, that begins the claims process. If it is at Gmail or at Yahoo, because I know a lot of organizations still do use their information with those free email services, then our data team will reach out and verify that you do work at that organization and are authorized to do the claiming. And so when an organization claims, you have access to the My Program tools, which gives you the ability to see all of the inbound referrals. The calendar and agenda is something that we will turn on. The ability to edit your program listings, add teams, and have data access to your specific program, search data and analytics. So first thing that anyone does, I would hope, is once you've claimed your program, to make sure that it is worded the way that you would like, and that the hours and information are correct. So the first thing that anyone does is usually edit their program. So I would click edit program. And inside of this, if my program name is changed, because I know a lot of folks have to change their name based on their grants, so you can edit that, change how people should contact your organization. This is public information here. So the main phone number for your organization, if there is a public email, you can actually remove the email if you don't have an info ad or a program email specific for your specific program. Here's how you can change your availability for your organization here. And this is where you would change your description. And again, you can change who do you serve and the program tags for people to come up. Next, if you go to My Program Tools again and click on Edit Program Listings, you would be brought to Edit Contact Settings. And this is part of the free tools that we're talking about. You have pass along information on a one-step referral. And so that's that original page where it's Malik, it's his name, phone number, and email. And that little email that I showed you before will get sent to these staff members in my organization, but that doesn't get published anywhere. So a person on Aunt Bertha or one of our sites would send a one-click referral, and you would get an email about it, but that wouldn't go to anyone else other than your email or the appropriate person in your organization. Secondly, we do allow for a free eligibility screener, up to 20 questions, to allow a person to fill it out based on your requirements. And there you can actually add, so health, it's an eligibility question. So like over the last 12 months, how many times you've been in the emergency room. If they have never been, then they're not eligible for my program. And so if an individual is filling out this form, you can make it so that they get an immediate response of their potential eligibility. You then can write your response. So if someone is possibly eligible, it's this box, and you can change the verbiage. And if they may not be eligible for your specific program services, you can also change the verbiage here and allow that person the dignity of a response immediately. Because so often I know that when I would either apply myself or help others apply for services, and I wasn't eligible due to the level of incoming referrals that people have, sometimes you never hear back. And so this allows people to get that immediate response that they may not be eligible, but you can still review that on your end to make sure that the information that they filled out is indeed showing eligibility or ineligibility. And that information lives in the inbound referrals. I'll show you that again in a moment. The other thing you can do, we can set up a scheduler for you. You can use that as an intake tool here, or just in general if you wanted to use it as a way to schedule folks into appointments. This is where you can link out. So I know a lot of coordinated entry programs have to use their specific service. So this is where you can link out to an application, scheduling on your own site or a contact form on your site. And here, this program can't help anyone who makes contact through Aunt Bertha. That is for if you are an organization that doesn't accept referrals, essentially, like food pantries, stuff like that. Or if you want to just have people call, that's the way that they have to do an intake, then you can have that as well. So Kaiser has gone with someone else. Sutter Health is one of our customers. The Mayo Clinic is one of our customers. Stanford Health in their, I can't remember which subunit, is one of our customers. I believe Cedars-Sinai is on their way to finishing a contract. We have multiple hospital customers. So if you're interested in any of those more specific questions, if you go to auntbertha.com and scroll down on the For Customers page, or I think it's actually the About page. No, it's For Customers. And here you go. So you can see health plans, health systems, all of the different organizations that are our customers currently. There's a lot of them. So yeah. So now that you've updated how people can contact you, the last thing that people should update is hours and locations. So you can actually add pretty much an unlimited amount of office locations for your program. And when someone searches, it will come up based on the closest to their zip code. And if you do not have an actual physical office, or if you are providing services in a confidential safety manner, like a domestic violence shelter, you can actually have it be a confidential location and hide from appointments. So that is one way that you can also have your program listed. I talked about the inbound referrals. So if an organization has if you have multiple programs, each program is listed separately so that an individual in need can find the right program in the easiest way possible, rather than sifting through 5 different program like descriptions on a website. They can find just their senior services, or just their just their senior services, or just their teen services. And then general accessibility, I didn't go into this, but we do have a commitment to accessibility. So you can see our information on how we are certified for screen readers. And if you have any other information that you would like, you can always reach out to our email here, or support@auntbertha.com usually. So that's just a little tidbit. And so this is where the program information is. And I'm actually going to follow through this for a little bit, and then I'll have plenty of time at the end to do more questions and answers. But I'm going to continue on right now. So you can see here those incoming referrals, those one-step referrals also live here, and you can update that information. as you go along. We try to make this able to be added to anyone's workflow, so it's a little generic, so then you can use it as you see fit. So I can say that this person got help, but this person I was not able to contact. And so that was important, because if I'm a caseworker and I'm making that referral through our system, I can actually see that update in my people I'm helping. If you turn on a eligibility screener, you would, as I said before, this is the email that you get if someone submitted a screener. And this is where that screener lives. And it says may be eligible, may not be eligible. And you can actually view their responses, so then you can verify that eligibility or ineligibility according to your program. And as I said, the people I'm helping tool, it's the view profile. It creates a profile for them here. And this is our light case management. So if you don't have a case management system and you'd like to use this to track what you're doing with your folks, you can add goals, check the navigation history on all the referrals that you make on their behalf, and whether or not they were closed out, you can update it here as well. My favorite is that my cat needs a checking account, but he doesn't like banks. So I put his goal on hold. And you can actually, use this as much as you like and share this information among your team. Again, I need to turn on team sharing for you. So if you're interested in any of that, please contact me afterwards. So aside from the inbound referrals, you do have the ability to set up a calendar. So just a quick snippet on the back end of what it looks like to add as many staff members as you want to it. And you can easily change eligibility for any of these folks by putting in that. It comes up with which program specifically they have for scheduling, the staff member that it is appropriate, and length of meetings. And if you're wanting to add more people to your program, to your organization to be able to access all of this and all of the tools that we're showing you, you would go to My Program Tools and My Team and be able to invite other team members. You would put in their information. And inside of this, the two differences is admin can add other people and remove people, and a worker doesn't have that like super user access. Last part of My Program Tools, which I was sharing earlier, is the analytics. So everyone will have the access when you claim your program to the claimed programs dashboard. Also like what your search activity is. And then when you go through this, the claimed program dashboard, you can filter it by a specific program or all of your programs, whatever date range and aggregation. The way that this funnel works is how many people typed in a search term that your program would show up in the results, how many people saw your program, how many people clicked on your program card, and how many referrals you have waiting for this specific program. If you scroll down more, you can see how many times people have searched for your program, and also hotspots. So if you are a mobile outreach organization and you wanted to figure out, where's a good zip code for me to go and search in, I can see how many searches are being made on different zip codes, so that I can say, oh, there's like 30 people that have been searching in this zip code. Maybe I should do my health fair out there. And then you can also see my favorite little portion is what I call breadcrumbs. So these are other organizations that after people click on your program, people are also clicking on these other programs. So if you provide mental health services and people are also looking at dental services, that might be a new community partner that you didn't know you could have. And so that is all of the program tools. And I want to make sure that you see what all of those look like. So I had that saved favorites and that I had talked about earlier. So if you add things to your saved favorites list, which was the star at the bottom of each of the program cards here, you can add it to any of these personal folders that you have. And then this information is updated as we get updates. You can then share this list with people, either as a link, and you can shoot it off to people. You can email it to someone. So if you're working with someone and you have your top 10 organizations or however many, you can send them an email so that they can see this list. Or you can share it internally with your coworker group. And as always, you can always change it into the appropriate language and print it for the individual in their language that they are more comfortable reading in. So I'm going to go back to English and close this. I'm going to go back to English. And the different ways that programs look. So the eligibility screener, once you set it up, it will look like this after I... So this is where they would fill out the information. And I'm going to have it so that he is not going to be eligible because he has not had his services threatened. And so you can see after I submit his questions, based on your situation, you may not be eligible for services. And so if I had selected the eligibility question that he is eligible, that eligible, you may be eligible note would come up here. If you want to see what the scheduler looks like, you can click here. And so if someone is looking for services and wants to schedule, you can see that this office is the closest to my location. I'm going to schedule it here. And here are all the appointments in the intake language. I can book my appointment for myself. And now I've been booked into that appointment slot, and the person on the other side gets an email notification that they have been booked. You can also, if you don't make referrals, but if you don't actually make a referral to an organization, like they don't have the ability to, you can actually log a referral for people that you're helping. So Malik is already in my people I'm helping tab, and I can note that I made a referral. So this referral is not sent to the program, but it saves it for me. So you can see here that it is saved. And then the last thing that I was going to show you is, again, that quick one-step referral. So you see it in all of its glory. So again, that's like the back end of everything, of all the different tools, the people I'm helping. If you are helping someone self-navigate, you can actually, they can track the referrals that were sent on my behalf. And then, yeah, so did I get help from the program? Needs my action, or got help, or I'm eligible, whatever is appropriate for me. Now, I want to make sure that we have enough time for questions, so I'm going to just go through key takeaways. Remember, if you are an organization that is able to claim your program, please do so here. At the bottom, you can also then have access to your program tools, access the different ways of setting up contact settings, see that impact report, suggest other programs. And the reason why I'm breezing through this is because I'm going to include it in a follow-up email. We provide a free simple search box. So if you wanted to embed this on your website for people that may be searching for resources, it comes up in the same way that this zip code search box is the same thing that you would be able to embed with your colors and for your use on your website for people to be able to find services. Here's my pretty face as well. I'm here to make sure that I can walk you through in depth more of the program tools. I'd love to schedule one-on-ones with anyone. And if you have any questions, I'm going to actually send a copy of the form that I use for post survey. And here's my contact information. So I am going to check chat, and if anyone has any other questions, please feel free to ask them.
Thank you, Anthony. That was a lot of information and maybe overwhelming to some people. And just to remember that this was kind of a multi-layered presentation. So we have the end user, what you call the is it the searchers?
Yeah, seekers.
Yeah, seekers. So it's just a family member who wants to be able to look for local resources. So that is basically just going to auntbertha.com and putting in your zip code, and then you'll see a variety of options for looking. And then the next level is a program who wants to or is being listed here, and you want to claim that and update it and use that on the back end to help people find your program. And then the third is agencies that might want to contract with Aunt Bertha to have the system embedded into their website and with their case management and referral systems and so on. So Anthony gave a lot of information. I want to just give a anecdote of something that happened after the last training. The afternoon of the training, I got a call from a independent living skills worker in a county near me, and they were asking about assistance for an individual who just got notice that they were going to be evicted, and it was during COVID, and they had heard that they shouldn't be able to be evicted during that time if they couldn't pay their rent. And so I went on Aunt Bertha, typed in their zip code, typed in housing advocacy, rental advocacy, and was able to find some resources in their community that none of us knew about. And just by searching that, I was searching for it just on their behalf. I was able to click that email it directly to the staff person who had contacted me about it while we were on the phone, and she got the email with the resources, and then she also then was able to use Aunt Bertha in the future as a resource to find resources in her community. So that's as simple as it can be, just a parent searching it, putting in their zip code, looking, or an individual looking for food resources, healthcare, clothing, whatever it is that they need help with. Those categories are all there. But there are these other back end systems that are a lot more complicated that can really support case management. So I just wanted to kind of clarify that, because if you're just a parent who wanted to learn about Aunt Bertha, you heard a lot more than maybe you were bargaining for. But just explain the different levels of the presentation that Anthony was giving in an hour, which is a lot of information to cover. Thank you, Anthony. So let's go ahead and turn it over to questions that might have come up. Andrew, do you have some of those ready that maybe we didn't answer or Anthony didn't answer?
I see them in chat, but I also wanted to just point out that I'm sharing on my screen right now. This was actually a friend of mine that didn't know I worked for Aunt Bertha, and she was using Sutter's system. And as a mental health social worker and a mother of a child with special needs, like, she was shocked at what was on Aunt Bertha because she thought she knew all of it. Now the questions that I see here, I've addressed most of them. Do you have data on who is using Aunt Bertha? So I don't have data on the individuals, but we have like rich data analytics in different ways, depending on what you're looking for. Families, what are they saying about Aunt Bertha? I mean, this is an example of what people say here. How long has Aunt Bertha been around? About a decade. Does inputting each individual's goals and Aunt Bertha suffice. Oh, Andrew, you took over.
Oh, I was going to share the questions in a total format so you could just read them. Can you see that now?
Nope.
Hold on a sec.
But
I thought you were done with that part. I was not trying not to interrupt you.
yeah, no, I'm because I'm just reading it from the chat. So
Well, there were a couple that were way far back, and I don't know if you answered. I was trying to mark answered on the ones that I saw you'd answered, but I put a whole document together. Let me see if I can put it on the screen.
No worries. I'm just gonna continue with reading the chat. So let's see. Does inputting each individual's goals via Aunt Bertha suffice for ISP meetings through the regional center? I do not have information on that specifically. Sonia, do you know?
I would doubt that unless you are using it as a tracking system. Then you could print out some sort of report and provide that as your ISP. It's possible that you could adapt the back end of Aunt Bertha to have your goal information in it. If you're interested in doing that, I would definitely call Anthony and discuss that more. That would be probably a pretty complex process. And so I'm not sure if you would want to do that, if that would meet your needs, but certainly an interesting idea.
Yeah. And then so figure out searching other than zip code. So we start off with a zip code search for you to be able to get to that information about what programs are around. But then once you go into the zip code search, in the upper left-hand corner, you can then put in keywords. So like adult daycare, and it will come up with a different possible tags. Also, if you misspell, it will pop up as it's like Google. It'll figure out what you were trying to type. Can you put folders together of your favorites linked to your organization's profile page? If you mean like putting it in here in your information, like you can put it, if you claim your program and you want people to access your favorites, you can put it in your description here. Also, if your organization has more than one program, if you click on buy blank, it'll show all of the programs that provider has. I almost forgot to send out this here. I'm gonna point that in. So if you'd be so kind to let me know what I can do better. Let's see.
So I also wanted to add that I went through this process with Anthony last week and trying to make sure the state council's listing was accurate and represented all the areas and all of our offices and so on. And so Anthony or some of his staff are available to help you go through that process to make sure your various programs. So many of you, I know from your registration, are part of a program of some sort or agency. So if you want to be listed on this, go on, search, see if your agency is already on it. If so, claim it and update it, and you can be the contact for it and update that information. There's no cost to doing that. If you need help, contact Anthony. But any search system is only as good as those who add to and keep updated the information. So that's for all of you who are providers. Everybody can contribute to help making this as accurate as possible and helpful as possible.
Yeah. So yeah, Shanice, you have really great questions, but we should have a nice long conversation.
Thank you.
Yeah. So limitations for Aunt Bertha. I mean, I like to believe that Aunt Bertha is limitless and endless. But you know, I think that this is a tool to help people find services. We don't provide that like chat on the other side to navigate you. Um, and so it's not necessarily a limitation, because this is a tool and an empowerment for you as a member of the community, as an individual, um, and be able to use that to help people directly. What do I mean by claiming? So again, if you go to a program and it does not have a little check mark, it means that that is information that our data team has researched, found, and added to this system. And if you claim it, it means that you have access to all of the tools in the My Program toolbar, the ability to see all your inbound referrals, add people to your team, see your program analytics, and edit how everything is listed on your program card, including, but not limited to, the different ways of sending a referral to your organization. David, I believe that Sonia is going to be sending out the recording to you post-event.
Yes. Can we try our poll?
Oh, yeah.
Okay, we're going to put a poll up there.
I just launched it.
Thank you. We have 2 questions. One is, I am satisfied with this training on the Aunt Bertha Community Resource Platform. Hopefully you can go ahead and click one of those buttons. I see some of you are having access. And the second question is, as a result of this training, I am better able to advocate for myself and others I know. I think a lot of this is many of us who help other people find resources in their community. So I think that's a big focus for me in terms of getting the word out to many of you who help other people find resources for, you know, whatever zip code they live in, which might not be where you are.
Yeah, and if you're interested in a more helper-focused webinar, where we're just going over how to search, how to access these programs, and how to log the people you're helping and use all of that, and less of the background on the program tools, I am providing one of those next week on the 19th. You can view that and sign up for it by going to our company page for nonprofits. And here at the bottom, you can see all of our upcoming trainings across the country. And this is our monthly webinar series. So every month we have a webinar for those who help other people navigate, so social workers, case managers, etc., and those who are in a nonprofit admin role, or ones that would be managing a program listing. So if you're interested in any of those, also Sonia will be sending out my information, and I'm more than happy to answer any of those. So it looks like majority of folks have answered the poll. We'll give it another second, but looks like we got some pretty good answers. But yeah, also, if you have any other questions, like, please, again, feel free to unmute and ask them verbally, or type them in more.
Okay, I'm going to end the polling.
Okay.
And I'm going to share the results. There we go. Oh, I guess everybody couldn't see them till just now. All right, well, there are the results. So thank you all for participating in those questions. So let's open it up to any more questions that you have. For me, when we're searching for something on Aunt Bertha, sometimes the hardest part is figuring out the words or the categories to search for. So that's something that just takes practice as a helper. You know, helping someone figure out, is this a housing issue? Is it a food issue? Is it a mental health resources issue? Is it, you know, whatever the categories are that, and then within each of those categories, there are a lot of subcategories. So I think getting familiar with some of those categories, spending a few minutes kind of looking around and getting familiar with that will help you be a better helper to help people find the resources in their community. but sometimes even figuring out what category your own agency should be in can be a little bit challenging. But spending a little time searching around, putting in some zip codes, and seeing what services you find can be worth spending a few minutes practicing with. Feel free to go off of mute and ask any questions you have.
Oh, and this is not a fake background. This is a real background. The family that I stay with in San Francisco, the dad collects different kinds of rocks and minerals.
Quick question. This is David, or DJ is what I go by.
Okay.
We heard a lot about your cat. Do you have a picture of your cat?
Usually the cat's on right next to you, but you're not there.
Yeah, no, I'm not in LA, but let me see if I can find a picture of him. And
Okay.
I'm sorry.
I'd like to see, I'd like to know about Sonia's background. Did she paint that?
Oh, okay. Well, this is actually felt. So it's felted, and it's actually 3-dimensional, and there are even little creatures that are felted, and they're in it. So 3-dimensional little bird. I started construction or reconstruction in our house right before COVID, and so my walls are down to 2x4s, and so I don't have my curtain anymore. So this is a really bright window. So I'm hanging this, moved it from somewhere else, and I hang it behind me for otherwise myself would be very dark. But yeah, it's a Four Seasons picture, and it was actually made by a bunch of children, and they put the felt down and make it into a picture, and they wet it and they stomp all over it. So it's a felted hanging. So, and
That's
being lit up. Thank you. Yeah. It's enjoyed having more of a central role in my life and not just being on the wall over there since we're doing Zoom.
They're sharing.
Yeah, thank you. Look at all of the cats. And last time on our training, we realized that Anthony and my cat look very similar. So the cats got to meet each other through Zoom.
Yeah, so this is Malik. He's the red one, and the black one is Charlie. And then there's a girl cat as well. Her name is Pogo. And I just realized that this is getting recorded and sent out to everyone. But, yeah, so anyway.
So Malik is famous now.
Yeah, Malik's a really cool cat.
Malik.
He's very loud.
Question, Anthony, this is Morena. If a seeker is having difficulties navigating the website, do they just call this? Is there a phone number that they can call and get assistance over the phone in navigating the website, or how would that work?
So you can chat us. When you're searching, there is a little support chat that will pop up, but we don't have a call center for use with this.
Thanks.
Yep. But if you'd like to volunteer,
Well, I've really appreciated your presentation. I'm just coming in as a parent's viewpoint, but wow, this could be an incredible platform. All the effort and mental energy that's gone into it. It's so detailed for, like, you know, IFs and with the SDP programs developing and all the facilities. That's amazing. Thank you so much.
yeah, of course. And again, like, I know that there was a lot of information, but hopefully you were able to pick a few things that really stuck out that you're able to use afterwards. I encourage you, parents that you're working in your communities, if you encounter any nonprofits, encourage them to also take a peek and claim their program, because now you see the back end of what they have access to. And then, you know, the people I'm helping is for anyone that makes a referral. So parents on the phone, if you are helping your child or some other people, and yeah, I'm a bit nervous to update our COVID hours in case we forget to update it again later. I mean, I think we'll probably reach out, and then it also reminds us to check in 6 months. So if you put COVID specific hours, our teams are actually going to be going through and updating that whenever COVID stops being COVID.
What does that mean? Is that for employees? or updating COVID hours. What is that for providers of services?
Yeah, no, Christina had just chatted that they're worried about updating their hours as a program.
Oh, yeah, because my daughter is in the RES program locally here in Martinez in Contra Costa County. And how does that figure with the regional centers? Because they just got granted certain funds and they were looking for a way to, I guess they call them encumber them or something. And, you know, looking for, I mean, this platform is pretty amazing as far as reaching out to different ones that has the translation built in and everything else. So is that a conflict of interest or something like that? I mean, I don't understand. Is this like a business platform too?
Well, I just want to jump in here. So this is a search just for programs, and it's all different programs, not regional center specific. So go ahead.
The regional centers, can they use them? Like say my caseworker.
Sure. Yeah. Yeah, so your caseworker could use this on her own just as an individual. She doesn't need to log on. She could just search. Somebody could be on the phone looking for something, and like I did the other day, she could just go on to Aunt Bertha. She could search for, you know, housing in this person's area, and click the button and have an email go to them. On the other hand, the regional center could contract with Aunt Bertha to provide this as a tool really built in within the regional center case management system. So they could contract with them just like many of the healthcare organizations do. But that's not necessary. Just for any service coordinator can just use this and search while they're on the phone or emailing with somebody and find a resource and refer them. Again, encourage programs. If you know, like say, a program that your family member's involved with, I encourage them to check out if they're on this already and to claim it and update the information, because it's only as good as all of the community programs, you know, that are on there and put their information in. So encourage them to update their information and have it as accurate as possible.
Well, thank you. And thank you for putting it such a layman's term, Sonia.
That's kind of the language I speak, plain language. I wanted to address your earlier comment because you used a whole bunch of acronyms, and I'm sure Anthony was like, what is she talking about? But I think your idea was great about this is a great resource for independent facilitators who might be working within the self-determination program, which is a program that will be through the regional center, through Department of Developmental Services. So yes, it might be a great resources for any IF, independent facilitator, to know about. And so yes, absolutely, they should be using this and any other search engine they want, but this would be a great resource for them because as an independent facilitator, they could kind of have some of their favorites listed, and that might help them to access services wherever they're helping somebody, a participant in the self-determination program. So a great point, Joyce.
That would be good for those
Thank
facilitators to join in on.
Mm-hmm.
Well, even for the program that she is in a community program, just for them to claim their place there, it helps everybody.
Absolutely. And so there might be some basic information on here, but then when you claim it as a program, you know, like I did for state council, you can go in, you can double check things, you can add a little bit more description, you can, you know, update it a little bit to make sure that it's as accurate as possible.
Well, thank you again.
Absolutely. Thanks for joining us. Joyce, what area are you in?
I'm in Martinez, so
okay.
It's a regional center, East Bay.
Yeah, great. And many regional centers are listed on here. So if yours isn't, encourage them to, you know, get listed. Any other questions? We just have a few more minutes. Yeah, go ahead, Amanda. Just take yourself off of mute. Can you unmute yourself in the lower left corner?
There we go.
There you go.
So we have a nonprofit in South Lake Tahoe, and we provide services through the regional center. And I just recently heard about this and checked to see if we were in there, but I actually had to suggest us because we weren't even listed. So I'm, I guess, awaiting to be set up, or I don't know how that actually will work, but when will I be able to see our organization Trails at the Lake and be able to claim it and update?
Yeah, so within 2 to 3 days, we usually will be able to verify the listing and have it popped up. And then once that happens, then you can claim your program as soon as it's listed. Did you
Okay.
put I work here at the very bottom when you
Yeah.
were submitting? So then there's also going to be an email that gets sent out to you that says, make sure to claim, it's free and easy.
Right. Okay, because I just checked, I did get some emails like, thanks for submitting your request or whatever. And I'm, looking at the website now on my phone and still don't see our name popped up. But will I get an email saying, we added you, come claim us or claim
Yep.
your, okay. So I don't have to keep looking for it, it will.
Yeah. And also speaking of using your phone, so this is actually responsive to any size screen. So if you're using it on a tablet or on a phone, it will change. So then you are able to see your programs listed and help someone on a cell phone or a tablet or a full-sized computer, just as an FYI.
Nice. And then just another quick question, because we can't just accept folks. I mean, we could, but for them to qualify, they have to go through Alta and get qualified through them. So we could put on our little profile that, we don't do the referrals because we can't just do that. We have to have them referred through our service coordinator.
So what you could do with that is, as I had shown before, when you set up your intake tool, you can, I think I have one saved here. So contact on their site or like use the application, like apply on an external site. And that way, when they click on that, then they are applying through that the service coordinator that you use. Also, what you can do is if you have it on a one-step referral and they contact you, you can then respond to them with their next steps.
Okay. So we could do that, be like, in order to get our services, you have to contact this organization and okay.
Yeah, because I would suggest having the one-step referral on just so that you're able to then also see like all the information of who's coming in versus if you have it launch out to a website, like you'll be able to see that people were clicking, but you won't be able to see like the full like life cycle of if someone came in, found your program, and then we're trying to contact like what happened after they leave Aunt Bertha and try to contact Alta.
Okay.
So Anthony, don't move that screen. Amanda wanted to point out, so look at the bottom one, Adult Services, Supported Living Services, SLS. So that would be a similar situation where all of those individuals, who have developmental disabilities, make their informed choices, blah, blah, blah. If you look at more information, it might say, must be a client of the regional center or be referred through the regional center. So you can have that in your description. Those guys are in Culver City. But if you click more information, which I can't right now because I don't have the screen. Yeah, if you click to Anthony, they might have in their description, that the person gets referred by the regional center. So that would be, something that you could do. It's just to be clear about that in your description. Yeah.
Okay. Thank you. Yeah, this is great. I'm excited.
Yay. And of course, I really hope that you do follow up and schedule time with me so that I can help you make the most of any of the tools that we have and make it work the best for your organization.
Thank you.
Any last questions? And nice to meet you, Amanda. We've been emailing back and forth, but nice to meet you.
Yeah, thank you.
Through Zoom. Yeah.
I've been, or I think I've seen you before at the one of the recent IF seminars before COVID hit. So.
Yeah, great. And just a final plug here, if any of you are with organizations that serve people with developmental disabilities and you're looking for PPE, masks, and hand sanitizer and so on, be sure to contact your regional center locally or the state council office locally. We are all distributing PPE to our community in various ways throughout the state. So feel free to contact either your state council office or your local regional center to make sure that everybody has access to masks and sanitizer to be safe in the community. Well, thank you again, Anthony, for all of your time and sharing this information. Thank you, everybody, for joining. And I will send out an email. It may take a couple days to get the recording uploaded because it's all about handing out PPE right now, 24/7, pretty much throughout the state. So we will get that done and then share out an email letting you all know. I've got about 5 or 6 trainings to upload, and then I'll send an email with links to all of them. So thank you again. Thank you, Anthony. Thank you for your help, Andrew, with California Health and Wellness, and everyone for joining. And hopefully you all got Anthony's email address to follow up if he has, if you have any questions that you want to contact him directly with. So I'm going to end the call now. Thank you again for joining us. Thank you all taking the time, and stay safe and take care. Bye-bye.
Bye.
Bye. Thank you all.